Hi, my name is Denise Corson, and I am the program coordinator of the Adaptive Telephone Equipment Loan Program and a partner agency for the Rhode Island Assistive Technology Access Partnership, also known as ATAP. This partnership is designed as a statewide partnership of organizations, each with a targeted focus to improve access and acquisition of assistive technology for individuals with disabilities. This presentation is in collaboration with the Healthcare System Transformation Project on in-person assistive technology that can be used in healthcare settings to communicate with people with hearing loss. 48 million Americans have hearing loss from mild to profound. What does it mean to be deaf, and how does it differ from being hard of hearing? The answer depends on who you ask and what perspective you're looking at it from. The medical definition, the medical community defines deaf as a hearing loss so severe that there's little or no hearing left. While hard of hearing refers to a hearing loss where there may be some residual hearing, that auditory devices such as hearing aids and FM systems can provide adequate assistance to process speech. How the cultural definition is different than the medical definition is, according to the cultural definition, being deaf or hard of hearing has nothing to do with how much you hear, but who do you identify with? Do you identify with the deaf community or the hearing community? Culturally deaf individuals view themselves as a unique cultural and linguistic minority who use sign language as their primary language. Once you've identified whether the individual that you're speaking with identifies with either being deaf or hard of hearing, then you need to know what the best communication methods are for in-person communication. Basically, deaf individuals prefer ASL or American Sign Language, and hard of hearing people prefer to voice for themselves. Hard of hearing individuals prefer to voice for themselves, but some have a difficult time hearing or understanding what is being said to them. So sometimes amplification is enough, and other times they need more assistance like captioning. If the hard of hearing person could understand you, if you could only talk a little louder, then really probably all you would need to do is some type of an amplification device. So assistive listening devices, also known as ALDs, are basically portable amplifiers. They can isolate the speaker's voice and make it louder and clearer for the hard of hearing person to hear and understand what's being said. If the hard of hearing person says to you, I can hear you, but I don't understand you, this is what is known as discrimination loss. Discrimination loss basically means that the speech can be perceived in your brain, but it's difficult to distinguish between words and speech sounds. So amplification can help a bit, but captioning might be necessary for those types of individuals. So for in-person communications, there are many apps that caption speech so that the hard of hearing person can read what's being said. So again, if amplification is not enough, having a smart device with these apps on one of these apps on your device can allow the hard of hearing person to read what's being said to them. So there's many devices that are available both on iOS and Android, such as Live Caption, Otter, Ava, and a few others that I've listed on the PowerPoint. If you have an Android tablet or device, there is a built-in transcription option called Live Transcribe, which will actually put the words on the screen without you having to download anything. So again, it's only built into Android type devices. One other thing about some of these apps as well is some of them have a keyboard available so that if somebody has no speech or a hard time speaking, they can type back their responses to the person that they're communicating with. So if you meet an individual that is deaf, they're culturally deaf. That means they prefer to use sign language. So two options for using sign language interpreters, in person and remote. Remote is also known as video remote interpreters. In-person sign language interpreters are always the preference. So if possible, that is definitely something that is preferred in the deaf community. If they're not available, a video remote interpreter, it can be requested if that's all right with the individual. And basically, you would have to have an account with a couple of the companies that I have listed on the PowerPoint. And when somebody came in, you go into the app and you get a virtual video remote interpreter that you would face towards the deaf individual. And the deaf individual would sign to the tablet, and basically the interpreter would voice what the deaf individual is saying and vice versa, and sign back to the deaf individual. So therefore becoming that communication for you. What to really keep in mind are when you should not be using video remote interpreters and you should only have an in-person interpreter. Situations where there's a minor involved, situations in which a person is heavily medicated, intoxicated, or injured. When working with someone who has poor vision or an injury that compromises their ability to view the screen. Discussions regarding particularly sensitive information, discussions that are highly technical in nature, situations involving movement between multiple locations, situations occurring in areas with poor lighting or noisy, situations involving people from another country who do not use American Sign Language. So those are situations where you really should have an in-person. But having the availability of having an app and a account with a video remote interpreting service, again, gives you another option if somebody just walks in and there's no plan interpreter there for you. So it is always important to remember that communication is not about what is said or it's how it's said. It's really about what's understood. By recognizing the cultural communication differences between the deaf and hard of hearing and embracing technology, the medical community and the deaf and hard of hearing community can have a more effective communication. Effective communication is essential in any business, but even more so in healthcare. The effects of poor communication in healthcare can have extreme serious consequences. As with other businesses, poor communication decreases profits, but in a healthcare, communication fails negatively affects patient outcomes. Poor communication can result in misdiagnosis and other medical mistakes that can easily lead to avoidable health communications and the death of a patient. So I also, at the end of the PowerPoint presentation, are references and resources that you can look into more information on the topics that we discussed for in-person communication. Thank you.